So as Jono said, my role is student support lead at Edge Hill. I'm a senior lecturer and also manage our widening access to medicine programme. And I've been at Edge Hill for 2 years now, just over. And previously I was at Liverpool University Medical School, and I was there for 30 years. And there I was director of evaluation, but I also did admissions, and I did sort of an academic advisor role as well. So I've got perspective on and applications as well, and I'm gathering from certainly sessions that I've done previously that you will be about year 11, year 12 at the moment. So certainly if there is questions that you have or anything you want to ask, I'm happy to do when I've gone through the formal presentation. Anything you want to ask, an eye on the chat bar, so please do feel free to sort of raise any issues, and he can always interrupt me to bring those up as we go along, or we can save them to the end. I'm pretty informal in the way that I teach, so I'm happy to go either way. The title of my session today: Insight into your self-care, resilience and mindfulness, and especially how this can support your specific medicine, but nursing or another career. Some of this will be useful information for you as well, I hope. Start off, and I feel this is a little bit negative, so I apologise in advance, but I think it's really important to acknowledge. And the data slide that I have here is from a Freedom of Information request from the BBC to universities about the numbers of students who have accessed mental health support during the years. And as you can see, from 2012 right up to 2017, this is increasing year on year. And so more students are recognising or being advised that they need to access this kind of support. And in some ways, I think that's a really, really good thing, because no one should suffer in silence. No one should maybe be managing on their own with mental health issues. But I think it also raises the point that how can we help people before to this stage? And, sometimes it is people in crisis that we are dealing with. So I think it's important that, sort of prevention is better than cure in some ways. And it's important to acknowledge that. And so the next slide is more focused on medical students. I've worked in medical education for around 15 years now, and of the pressures that are on medical, even from the start of the application. And I think it's usually about, I think last year it was 8 or 9 applications. It is one of the most competitive courses in the UK, and I would say internationally as well. There's a lot of competition. And from very early on, when you're doing your UCAT, your BMAT, and then obviously writing your personal statement, getting the interview, it's competition right from the get-go, and that's hard to deal with, and manage. And I think when you're on the course as well, it's also a really intense academic workload. There is so much content to cover traditionally in the 5 years. And on top of managing all of that learning, you're also out on placement. And I think the emotional demands of that can be really, really hard as well. And in my experience, a lot of medical students put a lot of pressure on themselves to do well. They have very, they can be naturally very competitive. They've always been high achieving. There's a lot of pressure on themselves to do well. And I think a reflection of that is the slide that we have here in terms of emotional exhaustion, higher rates for medical students and the rest of the population, and depersonalization and withdrawing from situations, that's represented here. And burnout, massive issue in medicine, and that leads to issues around retention as well. And also screening positive for depression, and we have seen increases in that across medical education in the UK and nationally. And I don't want to be overly negative, but I think it's important that we talk about this and we appreciate this. And certainly some of the keynote speakers have been around so far today have also acknowledged the importance of well-being and how we need to handle this. So there are ways and means of doing it, which brings me to my next slide about what medical students say. And this data is actually from when I was at Liverpool. So again, it's a couple of years ago now. But as part of Freshers Week in year 1 at Liverpool, we had a wellbeing day. And basically the emphasis we had clinicians, academics talking about their own mental health and struggles. you know, when they accessed support, how it helped them when they weren't sleeping, maybe when they were drinking too much. One of my colleagues who's an anaesthetist, she was sort of saying that she'd actually fought cancer 2 or 3 years previously, but she said that wasn't as bad as the first time she found out her first boyfriend cheated on her. She said that dealing with cancer was easier than that. And I think people were sharing a lot of, and I think, you know, sometimes there's an idealized view of, you know, sort of doctors, medical health professionals as being able to cope with everything, but that's just not the case. We're all human. And so the focus of our Wellbeing Day was to talk about these issues and raise and signpost to the support services at Liverpool. And so some of the quotes from the evaluation, and I think at the start of the day, I think there was a bit of skepticism from the students, which was like, why are we here? Why is this important to us? You know, we want to go on to clinical skills and physiology and anatomy. But by the end of it, you know, after the sessions, and we had some workshops and we did some really fun things as well. And you know, we had dance class, choirs, all kinds of things, just to balance things and remind students that, you know, it's really, really important to have that work-life balance. And so some of the quotes that I've chosen here from the evaluation about a good well-being is essential to be able to stay on top of work and manage that stress. And I love this quote. I think it's really important. You can't look after a patient if you can't look after yourself, and it's not fair to either of you. And the next quote we've got is, raising our awareness of well-being makes us more empathic to patients. And I think that's absolutely true. Understanding mental health problems. I'm not saying you have to experience that kind of thing to actually be empathic about it, but I think it does offer more insight as well and can make people better doctors. I think we all need some time to reflect and think about how we are feeling and whether there are problems we need to address. And I know there's been, you know, several mentions of reflection in the keynotes that we've had so far. So again, just to underpin, I think this is a generally very important issue that we're dealing with. So this happened, as you're well aware, and again, thinking of you currently and thinking if you are year 11, year 12, and obviously you've been through a massive amount of disruption in the last like 5 months in terms of your school, your learning, you know, and how you manage things day to day. And I wanted to highlight the importance of Corona from the point of view of your own experience and reflecting on it. And I'll say a little bit more about this in relation to your application towards the end of the presentation. But I just think these issues are really important to bear in mind, is that, you know, going into medicine at the moment, you've been through, you know, a once in a lifetime experience in terms of the impact of the pandemic on your own learning, your own well-being, you know, your family, your community, your relationships, all these things have been impacted. But also, you know, going forward and working in the NHS at the moment, the repercussions of this are huge in terms of, you know, already there's data coming up, and I'm sure you'll know around the application process as well, that, you know, we always encourage you to read the news, you know, look at health related issues. You're likely to be asked about them in your interviews going forward. But there is like, you know, during lockdown, there was a delay in people seeking, you know, sort of especially mental health support or, you know, accessing care. And we're expecting to be dealing with this in the NHS for a long time to come. We don't understand the full implications, but the signs are that people have struggled, and, you know, there are going to be issues related to mental health. And you are going to be working with that directly. So there's managing your own experience during the pandemic, but also thinking now about how that's going to impact upon the care that you're going to be delivering in future, and working in the NHS as part of that as well. So we will have the slides available so you can look at that in more detail as well. So there's a couple of things on there. I'm not sure how clearly you can see it, but certainly changes in sleep or eating patterns, concentration, you know, increased drinking, these kind of things, which have been picked up again by other keynote speakers so far today. So just that you appreciate the importance and how cross-referenced and acknowledged these kind of issues are. Okay, so self-care, as I said at the start, I'm not going to give you like a massive range of strategies. I'm just going to give you signposting and tips today about this and why it's important. And I like the little illustration here. Self-care isn't selfish. It's, you know, you can't look after patients if you can't look after yourself, as we saw in a quote from a student earlier. So looking after yourself is absolutely paramount. asking for help and recognising when you do need that. And for me, certainly, that is a real sign of strength, you know, asking for help and support. That's showing a massive amount of insight. Really, really important. Sometimes you need to take a step back. And I said earlier as well that, you know, students, when you're doing your A-levels, when you're at medical school, you know, sometimes there's a lot of pressure on yourself, you know, and I think sometimes you do need to just think, well, when you're feeling overwhelmed, it's time to, you know, just maybe try and look at what you've taken on, what you need to reprioritize, how you can manage realistically as well. And I think forgiving yourself as well. And I think in relation to this, I think, you know, as I was saying before, UCAT, BMAT, you know, it might be that you don't get the scores that you want there. It might be you get to, you know, results day and it doesn't go the way that you want it to as well. You have to forgive yourself and move on from that. And there's a growing amount of medical education literature now, which is focused on learning from failure and, you know, being prepared to admit when things haven't gone wrong. But I think forgiving yourself is part of that process, because no one can ace everything all of the time. I think saying no is really important, and I know, you know, you've got friends, you've got family, you've got other commitments, but sometimes you may need to just say no. You can't manage anything else because you have to prioritize on, you know, it might be on time for yourself, or it might be on doing other things. Learning to say no is really important. I think spending time on what you enjoy, and I appreciate that can be difficult, or has been. I know a lot of medical students, or, you know, when doing A-levels, you know, a lot of people are involved in team sports and other activities, and you just haven't been able to undertake those, and that's a real shame, because, you know, it's great for your well-being. It's great as a social activity, you know, burning off, releasing stress, all these kind of things. So maybe you want to explore different ways of, you know, other things that, you know, you might want to, you know, find out about or try or experience when, you know, options are limited at the moment. The next point I've put is setting boundaries. And again, knowing how high achieving and, you know, how people do put pressure on themselves. I think it's, as you go forward into, you know, revision and, you know, and starting to plan for your exams and things like that, setting yourself like 10-hour revision sessions, or, you know, saying you're going to do this, this and this, it just doesn't work like that. I think you have to be really realistic, you know, doing two hours, you know, sort of an evening, or, you know, maybe setting boundaries that you're going to have some time to do other activities, you know, spend some time with your friends or your family, and walking the dog, doing something in your community, you know, those kind of things, being realistic about those boundaries. Putting yourself first as well, you know, you can't do everything for everybody. That's not fair on you either. So prioritising what you can realistically do as well. I've actually been, the emphasis on sleep today has been huge, with 2 keynote presentations, and I think there's a parallel session now on sleep as well. Sleeping and eating properly, just looking after yourself, doing the basics, again, really, really important to give you the strength and the energy and the stamina to do what you need to do. And changing what doesn't work in your life. And I think I said at the beginning, my current role is a student support lead, and I have students, you know, I'm still seeing a lot of students either face-to-face time or on the phone or live chat at the moment. And what doesn't work, and I think in the lockdown situation, it's been really harder for students to motivate themselves, you know, to get going, get your work done. And a lot of people, well, I would say I can think of at least 3 students off the top of my head who've had real trouble with social media in the last couple of months, because it's become such a big focus, because they don't have the usual things that they would do, and that balance. And so people have become really obsessed, and it's totally understandable about. So one student was really worried because she'd liked J.K. Rowling, but then obviously some comments she didn't agree with about what J.K. Rowling had said then about trans, and she was worried that reflected on her, and she got really upset about it. And I think sometimes these things in the current situation can seem like really out of control. And so there's several students that I've worked with that it's just like, okay, we're going to try and limit social media, not cut it out altogether. That's not realistic, but managing that time effectively as well, you know, deleting maybe accounts that might be negative, you know, having those switch off points where you don't want to get involved with discussion, or you don't want to get involved in, you know, any of those kind of negative online aspects which are really prevalent in life today. So changing those kind of things, I think, is important, and being genuine and honest with yourself, and with your friends, with your family, and being genuine and honest are such massively important qualities for practicing medicine, building up those relationships with your patients as well. So there's some of the aspects relating from self-care that I wanted to cover. I'm going to move on now to resilience, and as a bit of, well, I'm taking resilience to mean when something doesn't go your way, it's like, okay, then what am I going to do? How am I going to come back from this? How am I going to address it in the future? And so resilience, it might be, again, coming back, it might be UCAT or BMAT, that you don't get the score you wanted for a particular university. So where else are you going to apply? What else are you going to do? And also, looking, I remember last year, because CHIL, our foundation year for medicine, we went into clearing. It was our first year, so offers were a new thing for us in terms of how we managed it. And so we went into clearing, and we actually had 40 students come in for MMIs the following day. So results were out on the Thursday, and on the Friday, they'd come in for an interview. The majority hadn't got the grades that they wanted, and they were in this situation now. They may have had offers, that obviously were not valid anymore, but they picked themselves up and came in the next day. And you could tell that some of them, were a little bit shell shocked. But for me, that was a huge sign of resilience. It was the fact that they'd managed to get up, get on, get themselves organised, on clearing. And I think clearing is a bit taboo in some ways. Some of the schools and colleges that I've spoken with don't prepare students for this necessarily as well. It's always a good idea to have a plan about how you're going to approach clearing and what you're going to do on that day. Hopefully you'll get your grades, but just in case, it's not going to hurt you to plan in advance for everything. And I think resilience as well, working in the NHS at the moment, there's a lot of pressure, and you will have seen in the news, again, because you're reading as part of your application process and you're aware of these kind of things. There is a massive amount of stress on staff at the moment. So it's just keeping in mind how you manage it, because and I wish the NHS was better funded, and I wish there was all the support available for staff, and people didn't work over their shifts, or have shortage on on rotas and things like that. I wish that wasn't the way it is, but realistically it is, and that's the system that people work with. So it's actually being prepared to deal with that, and having the resilience to manage it as well. So again, thinking about how you would manage, and the sort of illustration that I have here about developing confidence and adaptability, and trying to be positive, avoiding those negative emotions that can drag you down, and getting things in perspective, and then mastering and growing from things, increasing your stamina to do this. And I think that comes back round to the points you're making about sleep, about looking after yourself, and self-care as well. So some of the qualities of resilience that I think are really important that I wanted to mention as well. Okay, and mindfulness has, it's one of these terms that has got really, really big in the last few years. And it's actually quite a simple context. I think of mindfulness that, in some ways, that along with, sort of reflection and going over things, being self-aware, again, if you are struggling, why you're struggling, and how you manage that. Trying to get some emotional balance in your attitudes. And I spoke before about these extremes of people getting very upset about social media or other pressures. It's trying to achieve the balance that you can think about it rationally and manage it better as well. And relationship management, with your family, your friends, how you deal with that effectively for your well-being, and thinking about those relationships going forward, and how you want to manage them and get the best out of them, and be there for people without putting too much stress on yourself. And I've seen that with students as well. And also a social awareness, medicine does not exist in a volume. And again, some of the keynote speakers were sort of saying, it's really challenging times that we're working in, and medicine is the best career in the world, but it's also one of the hardest. So it's being aware of the people around you, trying to understand that. And again, just trying to be mindful that, you can't cure all the people all the time, that there will be cut-off points for your own well-being that, you have to be mindful of as well. So again, there's so many applications and resources available. It might be from your schools and colleges, it might be from different websites or settings, you know, so many really good apps. And it might be like, you know, you start incorporating some yoga or some meditation. Those kind of things can be really, really helpful. Just going for a walk, getting outdoors, you know, a bit of fresh air, taking that time for yourself as well. So those aspects of mindfulness and managing, as I say, it's a competitive process that you're in. So it's being aware that you might need to, you know, have a little break for things, look after yourself a little bit better, and taking the time to do that as well. Okay, so in terms of your application, and as I say, I've worked in 2 medical schools and been involved in applications at the best. I think understanding your motivation for doing medicine, what you want to get out of it, if it's because you think it's like a really high sort of socially profile, you know, thing to do, it's probably, you know, you need to think a little bit more about why you want to do it and the reality of working in medicine as well. And I think demonstrating your self-awareness as well, that you are, how you manage stress and pressure, you know, a stressful situation, reflecting on it, you know, what you've taken away from it, and how you might do it differently in future as well. So again, these things are really, really important, and you know, you can put them in your application form as long as you can demonstrate how you've learned from it and how you've moved on or addressed things. And I'm not suggesting that if you have had mental health problems or something like that, I don't suggest you just put it in your application just to say it, and I have seen that in the past. But I think it's just to sort of demonstrate how you've moved on, how you've addressed it, what you've learned from it, you know, how it's important to you, and how it might have made you reprioritize things. It's fine to acknowledge these things, and you know, I would encourage that. I think it's really, really important to show how you've grown and developed from facing these kind of challenges as well. And balancing your life, you know, and I think, again, reading personal statements, sometimes they can be very, very generic, but you know, it is that you might play a team sport, but it's why that team sport, why does it matter to you, what do you get out of it, you know, and you know, how does it help you de-stress, those kinds of things as well. And acknowledging what you want to develop about yourself, what, you know, acknowledging maybe what your shortcomings are, and you know, maybe something that didn't go so well, something that, you know, might have been a GCSE, you know, might have been Duke of Edinburgh, it could have been anything, but things that you want to develop and improve. And again, that's self-growth and hugely important. We're all growing and learning all the time. And so I think these kind of insights and personal, you know, personal development is just absolutely key, and knowing yourself is an absolute strength. You know, it will make you a best doctor, make you, or support you in managing through the competitive process of getting into medical school, and then once you're there, how to manage as well. So I'm just going to finish off. These are a couple of slides because, as I said, I'm from Edge Hill. All of the sessions, the lectures and slides, we always finish on a positive message. So this is like key in our templates about mental health, and by signposting these resources. And even though I appreciate you're not at Edge Hill, but I just wanted to again emphasize, and I think most medical schools would be doing the same thing now, that you don't have to struggle alone, you know, that it's important that, you know, the support is there for you, you know, you have to access it, or maybe put some measures in place before you get to any point where you are struggling. But again, that's totally understandable. Just need to help you get through it and manage it effectively as well. So that was me talking quite. So thank you very much for listening and persevering there. So Jono, I don't know if there's anything you want to sort of pick up there.
No, I just wanted to thank you very much for your talk. Important points on resilience, well-being and self-care, and useful tips for applying to medical school. I think the thing that resonates with me a lot is saying no. I'm in my final year, and as a medical student, or even as a student, you'll be given loads of opportunities. People will present you with things, and you won't want to say no because you'll feel like you're missing out if you say no. You've really got to think to what time you have and just allocating to the things that you can kind of prioritize. It's better to kind of focus on a couple of projects and make it really good and do like a lot of projects, and then you'll get burnt out. You won't have enough time to focus on something. So I think that is what I took the most. If there's any questions from anyone, sorry.
Well, yeah. Even in application, there's so many things that people want to do, improve, or demonstrate their skills at. So, but again, it's being realistic. So thank you. I think that's really, really relevant.
So if anyone has any questions, please do type into the session bit, not on the events chat, but on the session chat, and we can hopefully answer them.
Yeah, I'm more than happy to answer anything you may have, either about what we've talked about.
Sure.
We'll be able to.
Yeah, they should be.
Yeah, the session's recorded, and so Jono's done a brilliant job on managing the technicalities.
Too kind.
I'm confident in your abilities. You're better than me. So yeah, the slides will be available as well. I've actually done this session previously. I think it was last September when we had the last National Careers Conference. But I actually have an inventory, so I'm going to type in my email address here. So Jayne.Garner. And it's just a little exercise for you to do to sort of look at ways that you manage your stress, and maybe some pointers for you about how you could manage better as well. So just put my email address there. If you're interested, please email me and I'll send that out to you.
We've just had a question from Rachel Batista. How lenient are medical schools when mental health affecting your studies during certain periods?
Okay, well, I can certainly speak from it's different in different medical schools. They will have different processes and procedures. But I think lenient, it's supportive. We want to support you and make sure you access the right support. So whether it's through your GP, and I know that I've had students who've been formally diagnosed with anxiety disorders, with other things, it's getting the right help and diagnosis to support you through that. But we understand that maybe if you do miss any sessions, obviously you have to commit, or you have to complete a core number of hours as part of medicine. And so if you've missed large periods of study, it might be that you agree that you might have to sort of sit out some time to recover, to get better and things, and then come back. But I would say overall, if it's impacted upon your studies, then generally we want to support you through it. All medical schools, we want to retain our students and we want to support you, so the overall, I would say it's making sure that you get the right help at the right time as well. Does that help, Rachel? Does that answer your question?
Lovely.
Oh, well, yeah. I would say another experience at St. George's. I'm sure the support service is available there as well.
Yeah, so at St. George's, in our Freshers Week, we're given like this massive spider diagram that's got all the different links as to who you should talk to. But I think what is really important is just recognizing that you're going through a difficult period and just trying to get some help for it, either by talking to your personal tutor or talking to the mental health team, faculty at university, because that's the best way that you'll be able to get some help in these troubling times. So yeah,
I would agree. And we have another question from Sophie. Any advice maintaining well-being through placements when sleep, etc., may be affected? Again, it will depend individually. I think it's really important if you are struggling to acknowledge, and I know at Edge Hill we have like a practice education lecturer who comes out and visits you on placement, who you could speak to. We also have your personal academic tutor as well, who might be able to signpost you to resources around, better sleep management. Again, they might signpost to your GP as well if you're having long-term sort of issues around sleep patterns as well. So it's if you can't manage it and you feel it's getting out of hand, I would certainly notify people like your personal academic tutor. And also on clinical placements, usually other staff are more than happy to discuss those kind of things with you as well. John, I don't know if you've got anything to add in your experience relating to that.
I think sleep hygiene is very important, and your lifestyle will affect it a lot. And then, so I don't know if you want to do any fitness or just play a game for a little while, whatever kind of helps your brain relax. I'd say typical health sleep hygiene things like don't go on your phone just before you go to sleep, because that will just kind of get stuck in your brain. Going to sleep relatively early, like you don't want to be going to sleep at like midnight or 1 o'clock. Although sometimes you may have like last minute documents or deadlines for projects you need to do, is really important to kind of get back up to that kind of minimum 8 hours of sleep if you can, eating healthy. And I think if you can timetable everything well, then that should hopefully give some structure, and then you can kind of plan around that. So you know how much time you have to spend on projects, how much time you can spend on placement, and then when to go to sleep. But again, you rightly said, if it does get a bit more serious, then definitely do see someone about that.
Yeah. Thank you for the question, Sophie. I hope that helped. You're welcome. Yeah, else got any questions either about applications or some of the issues that we've covered? I'm still not. I've done it in teaching as well, sort of waiting just in case, and then everything happens at once. So quite a strange way of working.
It is true. I mean, sometimes people sometimes they're either typing something quite long, or sometimes they're just a bit hesitant to actually write something. So honestly, guys, feel free to type whatever you need to do.
Yeah, one thing that I usually do say before I teach or I do any kind of work is there's no such thing as a stupid question. Likely somebody else will have asked it before, so you know, please feel free.
Around for maybe 1 or 2 more minutes, just in case there's any lingering questions. And then, but after that, maybe about 10 past, then yeah, that can be the end of the session. And I can kind of introduce the next one if you'd like.
Okay. Well, thank you so much, everyone, for coming along. I really appreciate it, because I realise how much, you know, sort of activity there is today as well. So I really appreciate you joining us and your questions as well. Thank you, and thank you to Jono for chairing as well. Much appreciated.
Okay, so when you're ready, if you press the leave part on the top right of your thing, then that can help you exit the screen. Yeah, thank you very much once again, Dr. Garner.
Oh, no problem. Thank you.